Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, welcome back, and we are in the last segment of tonight's show, and that kind of brings me into this topic of medical marijuana, which, you know, a couple of times a week I'm signing a medical marijuana card for people, and was looking at the NRS about it, and really it's any debilitating condition that might be relieved by the use of medical marijuana. And one of the things that is very useful about that is that no one that I'm aware of has ever died from an overdose of the use of marijuana, and quite a few people do expire every year from the use of opioids. So it's certainly an individual thing. There are no known studies involving that. Well, I guess there are some. If you talk to the DEA, they'll tell you there's none. But if you talk to the people who use the product, and they definitely will tell you that they do get some benefit from it. So there's a lot of people out there that are using it. I understand the Grove is supposedly going to open sometime, I think, as I heard tonight, the 17th of March, and so that will be a good day for some of the people in Pahrump. And I had a lady in the other day who basically was on oxygen, had COPD, and probably didn't want to make edibles, but I guess one of the places in Las Vegas actually had a vapor type substance that she was using for marijuana, which I thought was very, very good and very, very interesting. I thought it was very cool that they could do that, and how far it has come in that area. So hopefully we can get the people from the Grove on the show so that we can they can talk with us and with our crew, which I means you, the patients, answer questions about that. I know you actually have to have the card in your place to be able to go in the shop. It isn't like you could just go in and mill around and see what they have. You actually have to be registered with the state as a user, medical marijuana user. So, and I know they're limited to how many. I know most of the practices in town, because they're corporate, are not getting into the use of those cards. And I'm honored, Ray, the third time tonight. Thank you.
Yes, third time's a charm, Doc. You're on the subject that is dear to my heart. My brother back in '99 had cancer. He starved to death in 4 months because he refused to use marijuana. It was a felony at the time. He was in the 12-step program. And I'm on a mission since then because I know the positive effects of this. I've been watching all these different shows. The government is down on it. The cops are down on it and everything else. But this may be the miracle that we need. And right now, we're at a point in time where people are being jailed for 1 to 4 years for taking a hit off a joint, and in 20 years they're going to look back and say, what kind of idiots were back in 2016 that they didn't stop this insanity. It'll be on a ballot in November to decriminalize it, and that's what should happen. And I hope you do get the Grove on TV, on your show, because right now there's discrepancies as far as the amount of plants that can be grown. They have different cutoff dates for grandfathering. They have you said edible plant rider is no longer in effect, and so we got to clear all these things up so people who are growing legally with a medical use card aren't put in jeopardy by the authorities for, going over a date or something like that. So thanks for keep talking about this, and I appreciate it, and a lot of other people do too.
Yep.
All right, have a good night. Keep the faith.
Yep. Thank you very much. And yeah, I'm not clear on that issue too. I think it's a 35-mile zone apparently within a dispensary that then it becomes illegal to grow. But I don't know the answer to that, and I don't know why they would do that. I would think that if it's a so-called tax issue, not everybody can afford the markup price for marijuana. But that I hope at some point doesn't become a monetary issue. And of course, then there's the political side of it, and all people can do is, I wasn't aware that there was going to be something on the ballot to decriminalize it, but I think that's very appropriate. I think one of the things that came up when I was listening to that DEA agent talking about it, he's like, they're not really interested in anybody unless they got 1,000 plants. 1,000 plants, then you have the intent to distribute. So this is a federal government that really doesn't care about certain low-level issues, but unfortunately the sheriff's department and the local law enforcement does. So it does really, there are bigger fish to fry out there. The methamphetamine, the heroin trade, in fact the heroin trade has gone up substantially, and as a result of people not getting as much oxycodone, which they were smoking and taking like heroin. So that shows that the doctors are doing their job long before the pharmacists started playing this particular game. Well, anyway, we could talk about that all night long. But medical marijuana seems to be, in my mind, a suitable alternative for chronic conditions for people. And the only thing is that they do tell you when you get the thing how much cannabinoid, how much THC. It's really down to a really fine science, and I think that it has come so far in such a little bit of time, and I hope that it continues to do that. I'm not a proponent of recreational use. I think you really need to have a condition, because there is a risk and a benefit ratio to everything that we do. I think marijuana does have some things that, it does affect your short-term memory. It does affect other parts of your body, your mentation, and things of that nature. So there has to, in my mind, and not just because I'm a physician, I think there should be a good reason that you use it. Can it be used for sleep? Yes, it can. Can it be used for other reasons? Yes, it can. But there has to be a reason other than I'm just going to take a few hits off of this cigarette and I'm just going to chill out and watch Lever to Beaver and, have some popcorn. And I say that all in joke, but this is, that's the recreational side of it as opposed to the medicinal side of it. And like I said, if you have any chronic condition that is defined by the NRS as debilitating and causing you pain for which you have to take another medication, and marijuana can relieve those symptoms, then as far as I'm concerned, that fits the so-called square peg into the square hole to get you the medical marijuana card, and then it's up to you to decide what you're going to do. The other thing I would warn those people about is that the detection limits that they detect, which I think I read, which was 10 nanograms. If you're out and you have a registered marijuana card, and believe me, the local sheriff's department know when they pull your number up on your license plate, it's all linked together. They know you're a medical marijuana user, and if they see you make a wrong move, they can certainly pull you over and certainly test you. And if they find greater than 10 nanograms, which is really, that's not that long. 20 nanograms would pick up use within a couple of days, a week. 10 nanograms is like, you could be using it for, 3 weeks and still have 10 nanograms in your system. So that number is not right, and someone needs to basically address that issue. I use 300 nanograms to detect it, a use within a certain month. So, I mean, I use within a couple of days. 300 will pick it up in a couple of days. A higher number, the lower the recent use. So the lower the number, the longer you're going out, because that marijuana has a long half-life, and the THC product leaches out of your system over a long period of time. So, and I don't know if there's a law. I think there's a DUI law on that. And I found out very interestingly enough through another patient that there is no limit for driving under the influence of Xanax. So we're talking about a tranquilizer in your system, but there is no illegal limit on the books, meaning they can test your blood and see it in there, but they can't say you're intoxicated because there's no set limit which over that you are intoxicated. But there is with alcohol, and I believe there is one with medical marijuana. So those people the laws are there, but they also have to do some changing to make this a little bit better of a condition. But I think if you have a medical marijuana card and you're driving, I know this, that people who are on opioids, these kind of drugs, they drive all day long. And unless they make a mistake, they're never really pulled over. But this is unfortunate that they just run your name and then it shows up that you're a medical marijuana user with the state, and they know that you could potentially be intoxicated, but they know under no circumstances can they run your name and know that you were actually took a Vicodin pill earlier today, because that information isn't listed with the pharmacy. So that, I believe, is unfair, and I think that that should also possibly change down the road, and they may be using that against the marijuana users of the community. And like Ray said, the police are not in favor of it for whatever reason. But the idea that it opens a window to other drug use, certainly it spells something about you as a person, meaning if you're using marijuana for recreational purposes, then yes, it could open a window for other recreational drug use. And you can get yourself into a lot of issues with doing that. But when you take it for a defined purpose and use it for a medical condition, then you are very using it. Same way with your pain medications, taking them as directed, taking them as prescribed. Taking them less than prescribed will exercise a certain amount of due diligence on your part to make sure that you are not going above that. And remember, as I've defined in previous shows, the definition between a dependency and addiction is an addiction is defined as doing something despite the negative consequence of the action. So if you are taking your pills as not as prescribed, but as you deem fit, then you may have an addictive problem, because there are just certain rules and limits on what you're doing, and you need to make sure that you're following those rules and that you're not violating those principles. So that's how you set that line in the sand with that. So I want to thank you for tuning in. We're going to close the show tonight, and we'll hopefully see you here next Monday night. Have a great night. Thank you for tuning in.